Hey everybody, Dr. Jeff back here with another Menopausal Monday. So last week I spoke a little bit about the need for and the importance of screening mammograms. This is Breast Cancer Awareness Month and this theme continues today. What I'd like to talk about today is screening protocol or screening recommendations for those women who have what are called dense breasts. So dense breast tissue is caused by a discordance between the amount of what's called fibroglandular tissue compared to fatty tissue within the breast. So basically there's too much of the fibroglandular tissue compared to fat within the breast. Therefore, it makes them dense looking on a mammogram. Now, the problem with having dense breasts are really twofold. One is there does appear to be an increased risk of breast cancer for women who have dense breasts. The other problem is that sometimes cancers are missed on mammograms when a woman has dense breasts. It's estimated that about 45% of women have this problem or have this situation really. And so it's important to take a couple of measures to improve the best screening outcomes to ensure that we're not missing a cancer in those situations. Now, last week I talked about screening frequency, and I mentioned that women over the age of 50 could be screened once every other year. Women who have dense breasts, in general, that density tissue does go down over time, and it usually is better after menopause. But quite frankly, some women will continue to have that tissue density for the rest of their lives. It's important for women who have been told that they have dense breasts to make sure that they're being screened annually as opposed to every other year. It's also important that a woman talks with her provider about making sure that a mammogram is a digital mammogram as opposed to maybe an older style mammogram picture, which is called a 2D or a two-dimensional mammogram. So we want to make sure that a digital mammogram is done as a greater preference over a 2D view. The other thing that could be implicated here, again, really depending on the history, might be an ultrasound of the breast tissue. The problem with doing routine ultrasounds, however, is that they've shown to be kind of user dependent. So it depends on who's doing the ultrasound. Is it a tech? Is it the radiologist, etc.? So there can be a great amount of variability, it's been shown in studies, between who's doing the ultrasound. So oftentimes we will have women do annual digital mammogram screening. Now, the last point here is that for women who are on hormone therapy, we often ask that those women stop their hormone therapy for about 5 to 7 days prior to the mammogram, which would improve those images. The other thing is that if a woman is cycling, we recommend that that woman wait about 7 to 10 days after her menstrual cycle to have her mammogram. By doing these two things, you can improve the density rate on the mammogram and thus give a better picture and understand your situation better. So hopefully these recommendations were helpful today. If you have more questions about this, please don't hesitate to comment below. Certainly make sure you're talking to your doctor about the need for imaging and specific imaging if you have dense breasts. Talk to you later.